Today we're diving into a topic I know many of you are curious about: how to prevent and treat jowls. So if you've been wondering about those little changes around your jawline and how to keep your face looking its best, stick around. Well, let's start with the basics. What are jowls? Well, jowls refer basically to small fat pockets that droop below the jawline. And there are several reasons why you develop these pesky fat deposits. Well, basically fat that is normally above the jawline can droop below the jawline due to skin laxity and muscle drooping. So the skin can droop and the underlying muscle layers too, particularly in the platysma and SMAS muscles. So why do the skin, fat, and underlying muscle layers droop? Well, the aging process can result in collagen loss, and this can be accentuated by too much sun exposure, poor diet, stress, and even genetics. And these are all key contributors to the drooping that occurs with the face. It's also important to note the difference between jowls and perioral mounds, which are fat pads around the mouth. Now, they're often mistaken for each other, but these are completely different. Jowls refer to fat that has fallen below the jawline, but perioral mounds refer to fat that has accumulated above the jawline to the side of the mouth. Basically, perioral mounds are kind of like the jowl fat that hasn't drooped below the jawline yet. So how can you prevent jowls from forming? Well, the good news is that prevention is possible. Like most aging issues, preventing jowls from a true holistic standpoint starts with diet and lifestyle changes. In order to prevent collagen breakdown and premature aging of the skin, you're going to want to eat a collagen-preserving diet with plenty of protein. Some doctors recommend aiming for 1 gram per pound of your ideal body weight, or approximately 30 grams of protein per meal. Now, in order to reduce chronic inflammation, you should also eat colorful fruits and vegetables, along with healthy fats like olive oil, avocados, and wild-caught cold water fish like salmon. And of course, skincare is also essential to preventing jowls. Now, the first step is to protect your skin with a broad-spectrum SPF 30 or higher sunscreen. UV damage from excessive sun exposure is one of the main agers of the skin. So applying a sunscreen when you're out is absolutely essential to keeping your skin tight and youthful. Retinol is also a must-have. Retinol basically does, honestly, everything. It stimulates collagen, it thickens the skin, and it exfoliates. My Youn Beauty Retinol Moisturizer can give you amazing results and is the cornerstone for an anti-aging skincare routine. Now, peptides are another powerful ingredient for collagen production. Peptides act as cellular messengers to signal our cells to create more collagen. Now, I recommend my Youn Beauty Peptide and Bakuchiol Moisturizer, which is one of the newest Youn Beauty skincare products and the fastest growing in our sales. You combine it with the Retinol Moisturizer for a perfect 1-2 punch against aging skin. Well, technology also offers additional options to prevent jowls. My favorite at-home treatment for preventing jowls in the long term is red light therapy. Studies show that red light therapy can help stimulate the skin's collagen and elastin in just a couple short months. And I'll link my favorite devices in the caption below. Well, how about microcurrent devices like the NuFace or the Foreo Bear? Well, most doctors agree that microcurrent devices can temporarily tighten facial muscles. So these are great for a quick lift, but the jury is still out whether they can create long-term changes. Most doctors believe that they probably don't. Although you may see TikTok influencers claiming techniques like gua sha and facial massages can give you a snatched jawline and improve your jowls, all they do is reduce swelling, which can make the area look better just temporarily. No matter what these influencers tell you, they're not a long-term fix for jowls or to snatch your jawline.
When you do your jaw.
If you already see jowls forming, then there are solutions for both mild and severe jowls. For mild jowls, Morpheus8 is a gold standard for non-invasive skin tightening. This super popular treatment combines radiofrequency deep heating with microneedling. Most practitioners believe that it can create some mild skin tightening, which can subtly improve early jowls. The downtime is only about 1 to 2 days. Fractional laser treatments are also effective for tightening the skin, but they often require more downtime than Morpheus 8, sometimes as long as 7 days. Yet they don't necessarily tighten the skin better. Dermatologists and plastic surgeons are now using topical exosomes, which can help speed recovery with both types of treatments as well. Well, what about Botox? Can that lift jowls? Well, if it's injected into certain muscles of the lower face and the neck, it can temporarily relax the muscles pulling down on your face. And practitioners call this the Nefertiti lift. And it can help certain patients with mild jowls to see some mild improvement in them. Results last about 4 months. Now, if you have a narrow face or jawline and you are dealing with mild to moderate jowling, then fillers can actually be used to widen the face in this area. By doing this, you can cause the jowls to essentially tighten and improve. Now the key, though, is that this treatment only works in people with narrow faces, that they're okay with the face looking wider. It won't work on an already wider or rounder face because then the face may look too wide afterwards. And some doctors are also injecting filler both in front of and behind a jowl as a way to camouflage it. This really only works once again with pretty mild jowling. So what about Kybella or liposuction? Can these treatments remove the fat of the jowls to improve them? Well, theoretically, yes they can, but the problem with these treatments is that there is a branch of the facial nerve that often runs through the jowl, and injecting Kybella or liposuctioning the jowl may cause that nerve to become damaged. This can result in a crooked smile afterwards, which may or may not improve. Thread lifts are another way to improve mild to moderate jowls, and they can work for about 3 to 6 months, but that's usually about it. These treatments are very expensive, so make sure your doctor is honest with you about the risks, cost, and limited benefits of a thread lift before you have it done. In general, I don't recommend thread lifts. Now, if you have moderate to severe jowls, I'm sorry to say that a lower facelift is the most effective and really the only effective option. If you look in the mirror and you pull the skin of your face up and back, then this is what a lower facelift does. During this 3.5-hour operation, I remove the fat of the jowl below the jawline, tighten and lift the muscle layer underneath, and lift and remove excess skin. No question, the facelift is the absolute most effective way to get rid of your jowls, but it comes at the expense of an operation with about a 1 to 2 week downtime and permanent scars in front of and behind your ears. Now here are some of my patients who've achieved significant improvement in their jowls after undergoing a lower facelift. So this is how you treat jowls, but what about dark circles or bags under the eyes? I'm starting to get them. So check out the video right up here where I give you simple, holistic solutions to your dark circles. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.